Good morning, everyone, and welcome to the hybrid award ceremony for the HHS Green Champions Awards. This morning, we celebrate the winners for the fiscal year 2023 HHS Green Champions Awards. I'm Captain Leo Gomapis, the Environmental Engineering Program Chief within the Real Property Policy and Strategy Branch within the Real Property Management Service area under the Real Estate Logistics Operations Portfolio of Program Support Center. Before we get started, I'd like you to know that we will be recording this ceremony for future viewing. The HHS Green Champion Awards are administered by the Program Support Center, Real Property Management Service area within the Real Estate, Logistics, and Operations portfolio as part of the Go Green, Get Healthy HHS initiative. And it is my pleasure to welcome you and our esteemed keynote speakers. Our Assistant Secretary for Administration, Cheryl R. Campbell, who will provide insights at the HHS level, and Minu Shakuri Eliza, NIH Technical Lab Manager, who will share her perspective as a 10-time Green Champion.
My name is Cheryl Campbell. It is my privilege to serve you all as Assistant Secretary for Administration and your Chief Sustainability Officer to lead HHS's efforts to develop policies, programs, and partnerships to advance sustainability and climate-resilient federal operations. I am proud to recognize our HHS Green Champions for their amazing accomplishments in support of the HHS mission. Your commitment, creativity, and leadership towards protecting, advancing, and achieving HHS's sustainability and climate resiliency goals and public health indeed are to be honored and celebrated. Your innovation, dedication, and leading by example for a more resilient future helps us to reach our full health potential and inspire fellow staff. The Green Champion Awards represent more than exceptional accomplishments, but also a lasting impact towards protecting the health and well-being of Americans for generations. HHS focuses on sustainable and resilient operations to uphold the department's mission. By doing this, HHS can achieve its health and human service mission requirements while restoring, protecting, and maintaining the natural systems, services, and resources that make life possible, including clean air, clean water, and clean soil. Our practices and the work of the Green Champions are part of our commitment to support sustainability, take on the challenges of managing current and future risks posed by the climate crisis, and protect our health. A key policy that I issued in my first year in office was the 21st Century Workplace Space Planning that eliminated the practice of dedicated seats for all employees, regardless of how often they report to the office. The policy sets forth a maximum allowance for each seat based on an employee's on-site presence. Since issuing the policy, HHS was able to reduce 228,540 rentable square feet, saving over $10 million per year in rent and related costs. But more significantly, decreasing our facility carbon footprint to help address global warming and carbon emissions, while also reducing our exposure to climate hazards. HHS is not stopping at that amazing feat. We are constantly evaluating our facility utilization and working to reduce our footprint by another 200,000 rentable square feet, saving $14.6 million per year. HHS is also working on a formal HHS-wide policy to advance sustainability for food service concessions and vending machines in federal facilities, which includes requiring HHS divisions to promote healthy food choices, community development, and food safety. I applaud HHS's collective efforts in fiscal year 2023 regarding facility sustainability. HHS is increasing energy and water efficiency in its facilities by reducing energy and water use intensity by 3.6% and 8.1% respectively. The department has also increased carbon pollution-free electricity usage by 5.1%. As mentioned by Mr. Mayock, HHS continues to serve as an example of climate resilient and sustainable operations within its federal operations. Today we've asked Minu Securi Eliza, a 7-time HHS Green Champion Award winner, to share her experiences incorporating sustainability into her work as a National Institutes of Health researcher and how she has inspired her colleagues. Minu has continued to promote sustainability while carrying out official duties in her lab at the NIH. She has created videos, posters, announcements, and articles encouraging Green Lab action. Minu has led team efforts to increase participation in the NIH Green Labs Expo and collaborated on the NIH Laboratory Freezer Challenge, which led to energy savings of more than $118,000 annually. Thank you, Minu, for your commitment to HHS and congratulations on all that you have accomplished. You and your fellow Green Champion winners inspire me every day to continue to serve not only as the Assistant Secretary for Administration, but also as HHS's Chief Sustainability Officer. Thanks to all the HHS Green Champions for all that you do, and congratulations on your well-deserved awards. You are truly making a difference for our nation. I would like to pass things over to Minu for her remarks. Thank you.
I like to start with a quote that applies to the sustainability community at the NIH. A quote by Margaret Mead. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. I'm honored to join you today as a colleague, as a member of the NIH sustainability community, and I appreciate the Department of Health and Human Services and HHS Green Champion Awards team for allowing me to share my experiences in promoting sustainability at the NIH since 2011. We are fortunate to have the strong support and encouragement of our NIH senior leadership, which has helped us cultivate our passion for environmental sustainability. Collaborating with excellent team of Division of Environmental Protection under Mr. William Kenny Floyd, leadership has been vital, especially the sustainability group. And I can see some of them in the audience. Lucy is one of them. As you know, I'm from National Institute of Diabetes and Digestive and Kidney Diseases. It's called NIDDK. I want to extend my gratitude to my Institute Director, Dr. Griffin Rogers, our Scientific Director, Dr. Michael Cross, and our Executive Officer, Ms. Camilla Hoover. And special thanks to our LCDB Chief, Dr. Julian Dean. Their outstanding support has been crucial. At last, but not least, I want to thank the staff, lab members of 3 groups that I have worked so far at the NIH, at LCDB, LDB, and 2 LBG labs. Without your participations, programs cannot be successful. How did I join sustainability and why? My family has always inspired me to reduce waste, conserve energy and water, and advocate for change. So in 2011, actually I joined in 2009, so it's a 15-year work in progress. I joined the meetings and then we put it into action in 2011. Dr. Jean Tian Kohler and Ms. Trevor Blake started some sustainable practices, but in this year, they joined us with Dr. Daman Kumari, Ms. Barbara Swisler, and I, and with the help of Division of Environmental Protection, we pioneered many green labs fairs at NIH. Just to expose people, these many green labs fair, the one in Building 10 that I was one of the coordinators with Jean, had the highest attendees. So we decided we don't want to just spread our efforts. We need to strategize and be in one location. So we moved and we changed the name to One NIH Green Labs Fair in 2012. It was so successful that NIH Research Festival coordinator asked us to join them. So since 2013, we are a part of NIH Research Festival. That significantly increased participation, of course. But if we just show people once, should we expect them to follow those practices? Can you remember if you go to a conference and just see something and then apply that? Well, not for everyone. But let me tell you this, since 2011 to 2019, we spent our summers, so we didn't have virtual meetings at that time, in-person meetings in summer, planning for fall Green Labs Fair. I appreciate all of these were volunteer efforts. But due to pandemic, COVID-19, we switched to virtual ones. Some of the people have moved on to administrative sites, but Daman, Barbara, and I, with the help of Mr. Joshua Haynes from DEP, we are currently planning for 2014. So encouraging researchers needs convincing. How can I go to a lab and expect them to switch? I switched to a safer chemical. So we had the poster. In this poster, you could see side by side mutagenic, dye, effect, staining, and the safer substitute. We are very lucky. Supply Center, NIH self-service stores, they are joining our efforts. They are part of the Green Labs Fair. They attend every year and they bring this. So it's easily accessed for people to have this and use them. Besides this, it's not just using safer chemical, it saves. NIH saves not to have to process hazardous mutagenic waste. So people need to see that sustainability is cost saving. If those you cannot convince by just sustainability, talk to them about budget saving, they will listen. Besides safer chemical, we advocated for digital imaging. We shared with the lab moved, we purchased one, so have implemented in 2 lab and branch that have worked so far. This also reduces the toxic chemical and eliminates the need for dark rooms. Some of you might have seen the dark rooms that are not well kept. The chemical can seep through, even through the concrete. So that's another saving for facility, switching to digital systems, not using X-ray films, and not paying for maintenance. That's cost saving. In 2012, I was told by a vendor, just one imaging system. So imagine there are so many competitors that they had the highest sales in 2012. So that means some effects of our Green Labs Fair. People came, saw it, now they're trying. And also we had construction, if you don't know, never ending construction in Building 10. So I actually motivated one coworker. I said, why are you looking for dark room other side of the building and you have to go down to the first floor, take another elevator up, saves time, let's switch to digital imaging. They did actually. Besides these Green Labs Fair, I've promoted other programs. Take Back, Styrofoam Take Back program. That was a very popular one when attendees visited and talked to me near our posters, said, how can I have that program in my building? I said, just get involved. It can happen with your help. It has been expanded. We had in a few buildings. Now it's been expanded to many buildings. I've also helped with NIH Green Labs program and NIH Freezer Challenge. These programs have excellent leaders. One of them is sitting here. It's Mr. Virgil Thornton and Bonnie Bhattacharya and Mr. Yaroslav Sebek. It's the leader of sustainability branch now. It's been a learning experience to help NIH leaders. I want to share that NIH Green Labs program sends some awardees to International Sustainable Laboratories conferences called I2SL. I hope we can afford to send all of them, not to just selected few to the conference. They come back re-energized and motivated. One of them is Miss Helen Cowley. Elena is sitting right here, Serda Khan, and also Jessica Hale. They adopted Freezer Challenge program. With their help, we have increased participation almost twice, right, Virgil? I think, yes. So as the program coordinator of the NIH Lab Managers Working Group, I act as a liaison between that group and the sustainability group. This is a forceful, impactful group. I hope you will hear about them in the future. They're taking on so many tasks. Talented, dedicated people. I'm proud to be a member of that group. So with this role that I have, I assess the need, and then we have presenters. When they learn, they lead by example. Because of them, we have had increase in these sustainability programs. I appreciate Andrea Francisconi and Sarah Sarsfield of Lab Managers Working Group. Your work matters, and all of the committee leads. I like to see more participation of NIH labs in the near future. I'm incorporating sustainability into my daily work, and I like to inspire other people to lead the change. Thank you.
Thank you all for your insights on sustainability and climate change, and how we can all individually make a difference to carry out our joint mission of protecting human health in a sustainable manner. We find your message inspirational, and we thank you for taking the time today to celebrate our green champions. At this time, we will begin with the presentation of awards section of the ceremony. We ask that winners who are present come to the stage for their award tile and photograph. Virtual attendees, please refer to your emailed instructions on how to be viewed on the virtual stage. In other words, just raise your hand and then you will be spotlighted so everyone can basically see you for as your award nomination is read out loud. Additionally, detailed summaries of each award can be found on the Go Green, Get Healthy HHS intranet page under the HHS Green Champion section. A direct link was also provided in the program. Reading the award today are members of the HHS Sustainability Work Group, Chris Tremper with the CDC, Lucy Sis from NIH, Andrea Taylor from IHS, and Virgil Thornton from NIH.
All right. Can you guys hear me okay?
Yes.
Perfect. Thank you. As Leo said, my name is Chris Weisner, Sustainability Specialist with CDC. I'm excited to join you guys virtually from Atlanta to help recognize this year's HHS Green Champion Award winners. The first award category that I have the honor of presenting the winners from is Promoting Electronic Stewardship HHS Green Champion Award, and this award category recognizes developing and implementing programs and practices that promote sustainable environmental stewardship of electronic assets in any of the 3 life cycle phases for acquisitions, operations, and end of life. The winners in this first category are CDC's Desktop Reduction Project continued. Winners include Tim Horner, Calvin Galloway, Chuck Johnston, and David Foster. CDC recognized that laptops generally consume less electricity than desktops, and the CDC Office of Chief Information Officer embarked on a multi-year initiative to minimize the number of desktop workstations in CDC's network and achieve substantial electricity savings. In FY23, CDC replaced an approximate 3,894 desktop workstations with 3,488 laptops, and this achieved annual energy savings of approximately 309,000 kilowatt hours and saved more than $74,000. This also removed over 500,000 pounds of CO2 emissions saved from reduced electricity consumption. So congratulations to those winners. And if we can move on to the next slide, please. Perfect. This next category that I have honored to help present is Advancing Environmental Justice Green Champion Award category. This one is centered around environmental justice with agency mission, advancing the goals of Justice 40 initiative, where 40% of overall benefits of certain federal investments flow to disadvantaged communities that are marginalized, underserved, and overburdened by pollution, as part of planning programs and actions for sustainable buildings, fleets, and operations. The winner within this award category is CDC, ATSDR, NCH, Regional Tribal Environmental Health Summits. Congratulations to Sharonda Buchanan, Donata Green, Audrey Dowling, Rio Shondemeyer, and John Quill Dent. Tribal communities are particularly vulnerable to health effects associated with climate change due to the close relationship with the environment. Tribal populations experience similar effects, but also specific impacts within specific regions. And to address these concerns, in the summer of 2023, the CDC, National Center for Environmental Health, and the Agency for Toxic Substances and Disease Registry partnered with the National Indian Health Board to host a series of 4 regional tribal environmental health summits throughout the country. These summits were designed for tribal communities to exchange knowledge, share best practices, and identify solutions to address environmental health and environmental justice, health equity issues affecting tribal communities. Congratulations to those winners. And I will turn it over to back to the room for the next award category.
Hello. The Sustainability Innovator category recognizes outstanding efforts in integrating sustainability, climate adaptation, and resilience, and environmental performance into human capital systems and fostering an agency culture of sustainability, climate literacy, and environmental action through employee engagement, education, training, and performance management. Our first awardee is Elizabeth McKenna. Elizabeth created and implemented the CMS Medicare Plan Payment Group's Climate Action Initiative to assist employees in incorporating everyday environmentally conscious habits into their work and personal lives. Employees can track specific sustainable efforts throughout the quarter while accumulating points and showcasing climate action champions at the quarterly all-hands meeting. A large component of the initiative's mission to promote a holistic understanding of how climate change has profound implication on public health. Through the combination of individual efforts, the overall team, the initiative's goals are to reduce carbon emissions, raise awareness, and contribute to a more environmentally resilient future. Our next awardee is Patrick Sheridan for the increased sustainability awareness and access to climate literacy resources at the NIH by delivering multimedia informational resources tailored specific to NIH workforce audiences to communicate current climate and sustainability requirements. Mr. Sheridan's multi-audience approach enhanced communication of challenges, expectations, and the support needed to meet the requirements without impeding the progress of the NIH mission. These efforts included briefings to the NIH Executive Officers Bi-Monthly Meeting Group, coordinating NIA town hall meetings, and implementing a quarterly NIA Sustainability Brown Bag Series. Mr. Sheridan also has sponsored the design and production of more than 300 promotional materials for the NIH Green Labs Fair in the fiscal year 2023. Congratulations. The NIH Freezer Challenge Steering Committee, Helen Cawley, Jessica Hale, Helena Serta Kuhn, Minu Shakuri-Elize, and Carrie Hartung. This team collaborated to increase the NIH involvement in the International Freezer Challenge, which promotes efforts to reduce energy use and carbon emissions from laboratory freezers. In FY23, the team promoted posters and articles at various meetings. Overall, the team's efforts helped increase participation from 19 to 65 labs, saving an estimated 740,000 kilowatt hours per year and over $80,000 in energy costs, reducing greenhouse gas emissions by 546 metric tons of carbon dioxide equivalent per year, earning the NIH the 2023 International Institute for Sustainable Laboratories International Freezer Challenge in the government laboratory category. So congratulations to the group. The NIH Recycling Program Innovation was championed by Carrie Hartung, Paul Johnson, Bill Steinmetz, Cheryl Thompson, David Christie, Stephanie Bishop, Lisa Padilla Banks, Andrea Kaminsky, Lieutenant Commander Justin Bunn, and Paul Weisner. In FY23, the NIHS Recycling Program team took an innovative, multifaceted approach to reestablish proper workplace recycling habits. The team combined and updated digital resources and physical signage, in-person engagement, and online interactive quizzes. Quick guides for various space types were added, as well as more in-depth guidance by material type. To address the recycling complexities for laboratories, an online interactive database of commonly used laboratory supplies was developed. This database can be searched and filtered by item to display a photo along with a color-coded symbol designating its recyclability. Congratulations. Our next group is the FDA CDER Office of Study Integrity and Surveillance Remote Regulatory Assessments. A primary duty of the Office of Study Integrity and Surveillance is inspecting analytical sites that conduct studies supporting the development of new and generic drugs and therapeutic biologics and biosimilars. OSI's oversight work spans the globe, requiring significant travel to accomplish its mission. When on-site inspections are not possible, OSIS utilizes remote regulatory assessments to remotely audit bioanalytical studies. As a result, in FY23, travel was reduced by over 600,000 miles, cutting expenditures by $480,000 and reducing over 100,000 kilograms of CO2, equivalent to planting 5,201 trees. Our final group in this category goes to the 2023 NIH Green Labs program. The GLP is a self-assessment tool for labs to learn about environmental programs and either mandated by federal, state, or local law, or internal NIH and HHS policies and best management practices to reduce environmental impacts. In 2023, new and innovative strategies were developed to maximize participation and encourage labs to join, such as targeted communication and outreach with volunteers for daily GLP updates and requesting points of contacts to assist in obtaining support from scientific directors. These strategies increased participation by 87% and increased the NIH sustainable laboratory engagement by an additional 500 to 1,200 NIH staff. Congratulations to the group. The next category we'll recognize will be the building sustainable supply chains.
Thanks, Lucy. Hi, I'm Andrea Taylor, and I am the Sustainability Coordinator for IHS. And the next category we're going to talk about is building sustainable supply chains, which involves achieving net zero emissions procurement and increasing sustainability of federal supply chains, including acquisition, planning, purchasing, and contracting to reduce supply chain emissions, expanding use of sustainable products and services, and reducing costs while achieving sustainability and climate goals. Our first winner is Mr. Charles Edward Schaefer, the 6th of FDA, ORS Sustainable Paper Packing Material. The FDA in Kansas City Human and Animal Food Laboratories Total Diet Studies ships and receives several large coolers filled with food supplies every month. These samples were traditionally shipped with plastic bubble wrap for protection during transit, usually totaling more than 100 feet of bubble wrap per month. Charles Schaefer, Laboratory Support Assistant, researched a substitute paper packing material that expands like an accordion and developed it in a suitable green alternative to bubble wrap. He then obtained approval from management to purchase this material, which is now used to ship the samples. The packing paper is made from 100% recycled material that can easily be recycled or composted. It is also more efficient, easier to use, and costs much less. Congratulations. The next winner in this category is NIH Sustainable Laboratory Supply Chain Strategy. Scientists and staff within several laboratories and branches of the NIH National Institute of Diabetes and Digestive and Kidney Diseases expanded the use of sustainable products and services while also reducing costs and emissions through the effective management of common laboratory supply stockroom. This shared resource benefits various laboratory procedures required by the 6 participating labs and is maintained by a dedicated technical laboratory manager. The utilization of this space allows for advanced inventory planning, reduction of demand on supply chains, and minimization of disruptions due to lack of supplies or further supply chain stressors and/or industry shortcomings. Additionally, the reduction of duplicate supplies, reduced laboratory expenses, creating opportunity for a purchase of energy-efficient freezers, refrigerators, and centrifuges. Congratulations. The next category is climate and health equity. This award focuses on implementing an externally focused HHS innovation, activity, event, program, or policy with clear potential to build health resilience to climate and extreme weather impacts in communities and health systems, especially for those most vulnerable, thereby advancing equity per Executive Order 14008, developing and executing an innovative project, program, design, or idea that facilitates the climate resiliency or adaptation in communities served by the federal government. Our first winner is the CMS-CMMI Climate and Decarbonization Work Group, led by Michael De La Guardia, Delapan Sudamoria, Morthy, Perva Rowall, and Liz Fowler. The Centers for Medicare and Medicaid Services, Centers for Medicare and Medicaid Innovation, Climate and Decarbonization Work Group was organized to address the threats to the nation's health and its healthcare system presented by climate change, and in turn, the effects of hospital carbon emissions on health outcomes, healthcare costs, and quality of care, particularly to underserved populations who are disproportionately at risk. The team developed the first reporting strategy to collect greenhouse gas emissions data at Centers for CMS. This included specifications for reporting building energy metrics, anesthetic gas emissions, and transportation emissions in hospital settings, and refined the strategy through interviews with experts from academia, the National Academy of Medicine, the Joint Commission, and hospitals participating in a consortium focused on decarbonization and sustainability. Congratulations. The next winner is the HHS-GOV EMS Heat Tracker, led by Saha, Arsenio Mataka, Lauren Jensen, and John Balbus. It's lethal of all types of extreme weather, and heat exposure is worsening with the increased global warming. But until this year, existing data on heat-related deaths didn't analyze where people fell ill. In 2023, the HHS Office of Climate Change and Health Equity, in partnership with the Department of Transportation National Highway Traffic Safety Administration, launched the first of its kind online information portal called the Heat-Related Illness EMS Activation Surveillance Dashboard, EMS Heat Tracker, which maps emergency medical services responses to heat-related illness across the country. The EMS Heat Tracker provides data on population rate of heat-related EMS activations within a community, average EMS time to reach each patient, and the percent of patients who are transported to a medical facility for further treatment. The tracker helps public health officials ensure that outreach and medical aid reach the people who need it most, and helps decision makers prioritize community resilience investments. Congratulations. The next winner is the HHS-GOV FHSLN Federal Health Systems Learning Network. Joe McCannon, Aparna Bole, Lauren Jensen, Hardeep Singh, Andrea Taylor, James Luddington, Loretta Christensen, John Balbus, Paul Charlton, and Ben Schumann. The Federal Health Systems Learning Network is comprised of the Veterans Health Administration, the Defense Health Agency, Indian Health Service, and the Bureau of Prisons, and is convened and supported by HHS-GOV. The network conducted a project in FY 2023 to implement a set of measures to reduce greenhouse gas emissions associated with clinical practices. The measures included reduction of waste anesthetic gas emissions, reduction in physical and medical waste through reuse and substitution, and clinically appropriate reductions in the use of metered dose inhalers with potent greenhouse gas propellants. This is just one of the example of how FHSLN excuse me, is creating a community of practice to facilitate transformation of a federal health systems towards decarbonization and resilience, and to share best practices between the public and private health sectors. Congratulations.
Anybody else? Andrea.
The next category is HHS's AHRQ Climate Change Work Group, which includes Lionel Benez, Bill Freeman, Monica Haustetter, Angie Jane, Patricia Keenan, Pam Owens, Karen Rhodes, Bridget Russell, Brent Sandmeyer, and Mark Zodet. In FY 2023, the Agency for Healthcare Research and Quality Climate Change Work Group engaged in multiple activities to address healthcare's carbon footprint, resilience to climate-related threats, and inequitable impacts for climate change. The work group established a call for research to address the intersection of climate change and healthcare and conduct new research leveraging data from one of its largest data sources and publish a report on emergency department visits related to heat exposure. The work group also focused on collaborating with key partners within the outside government to address these issues, including hosting an expert roundtable to explore how healthcare delivery systems are currently measuring, reporting, and improving their resilience. In addition, the work group promoted AHRQ's climate research and resources to domestic and international audiences by publishing Helping Healthcare Systems Reduce Carbon Pollution, a new primer for AHRQ. Congratulations. The next winner is HHS OASH Inflammation Reduction Act, IRA, Quick Finder, and Health Sector Resource Hub. The winners include Jenny Kerouac, Joe McCannon, Aparna Bole, Yolanda Bird, Kimberly Siegfried, and John Balbus. On Earth Day 2023, HHS OCHI launched the Inflammation Reduction Act IRA Quick Finder, a guide that outlines opportunities for health sector stakeholders to obtain funding for investments in resilience and decarbonization. Recognizing the historic importance of this legislation for the healthcare sector and OCHI mission, OCHI reviewed the legislation in detail, distilled relevant programs for health sector stakeholders, and developed guidance on how to best address them. The Quick Finder document describes how IRA programs can assist them to improve resilience, increase sustainability, and reduce costs while linking relevant information and sites. In addition, the OCHI team developed the Health Sector Resource Hub, which provides descriptions and links to multiple funding and technical assistance opportunities for the health sector beyond the IRA, as well as a series of webinars to help orient health sector stakeholders, and all these potential resources. Congratulations. And the final winner in this category is the CDC Climate and Health Program's Cooperative Agreements to Support Health Equity. CDC's Climate and Health Program works with communities across the country to prepare for and respond to human health impacts of climate change. In 2023, CHP expanded to provide direct fundings and technical assistance to several new communities, Puerto Rico and new tribal communities. Through the Notice of Funding Opportunity, CHP provided funding and technical assistance to 13 jurisdictions. Of the $4 million Cooperative Agreement Program, 100% directly benefits disadvantaged communities, as all grant recipients are required to focus on health equity and work directly with underserved communities that are most impacted by climate change. Congratulations. And our next category involves environmental stewardship. I'll pass it to the next person.
Thank you. Awardees in the environmental stewardship category are being celebrated for advancing pollution prevention, source reduction, solid waste diversion, environmental compliance, and effective and innovative implementation of environmental management systems. So, our first awardee comes from FDA CFSAN Hazardous Waste and Glassware Process Management Team, including the following: Kevin M. Green, Martin G. Wright, Bryant Norman, Christopher M. Butler, Kelsey Mathern, Elrico Collins, Sabrina Hawkins Johnson, Sandy Talent, Lowry DeJagger, and Brian Bowes. In FY 2023, the FDA Center for Food Safety and Applied Nutrition, CFSAN, Hazardous Waste and Glassware Process Management Team diligently reviewed and enhanced the hazardous material and hazardous waste process and associated lab glassware transport and the recycling program at multiple facilities located in the Washington, D.C. metro area. The team documented misidentified critical steps in the process and assigned responsibilities for each of those processes while also eliminating redundant and unnecessary steps, realigning the entire process and reducing operating costs by roughly $185,750 per year. Congratulations. Next up, we have the FDA OLS Environmental Compliance Audit Team. This includes Desmond Abrakwa, Sigaran Pillai, Tanya Pittis, Timothy Jiggins, Cindy Rude, Sarah Bradbury, and Kelly Beck. In FY 2023, the FDA Environmental Compliance Audit Team, through sustained hard work and advocacy in championing program goals, exceeded program targets through completion of environmental audits at 3 FDA operations within the National Capital Region area, as well as sites in New York and Arkansas. The team's diligence and comprehensive environmental risk assessment improved agency-wide sustainability, climate change, and environmental protection programs, as it provided data for trend analysis that was used to develop targeted FDA-wide enterprise environmental training. Benefits of the team's actions ensured environmental compliance, reduction in negative environmental impacts, and a reduction in waste, water, and energy costs. Congratulations. Our next awardees come from the NIH Chemical Waste Compliance Poster Project with David Mohammadi, Matt Deptola, Ty Atkins, and Mike Stefan. The NIH Division of Environmental Protection, or DEP, conducts annual laboratory waste compliance inspections on the NIH Bethesda campus and leased facilities in Maryland. Based on inspection findings, awareness of compliance issues was found to be lacking. To address this issue and to ensure that all NIH laboratories manage their waste and comply with regulations, the DEP developed a comprehensive chemical waste compliance poster. This informative poster was created and distributed during FY 2023 and provides detailed information on best practices for managing chemical waste, along with instructions on how to dispose of hazardous materials safely. So far, DEP has distributed 273 posters to 257 laboratories and plans to deliver over 1,000 posters over the next 2 years. Congratulations. Our next group is the NIH Recycling and Reutilization of Excess Property Project with Willie Davis, Christopher J. Batzel, Sr., Javier Arce Colon, Camarlo Burke, and Michael Turner. The NIH Division of Logistics Services Property Management Branch, Property Reutilization and Disposal Section, or PRDS, is charged with supporting the recycling and reutilization of NIH excess property. In 2023, the PDRS engaged with the 27 NIH institutes and centers to collect, manage, and redistribute excess property through myriad approaches to prevent thousands of pounds of equipment from being treated as waste. They also donated more than 1,490 assets with a value of 1.6 million, reissued or redeployed 260 assets with an aggregate value of 2.7 million, and transferred 53 assets with a combined value of $326,214 to other federal agencies, as well as recycling more than 900 lab-grade freezers and refrigerators and 825 biohoods and fume hoods. Congratulations. Next up, we have the NIH RTP NIHS Transportation Reduction of Soiled Animal Bedding, featuring Paul Poliashik, Brian Harris, William Ragland, Ben Hockett, and Paul Johnson. At the NIH National Institute of Environmental Health Sciences, or NIHS, the cost of transporting soiled animal bedding from the facility became very expensive after the composting facility refused to accept the bedding and it had to be shipped to a specialized landfill. With this change, hauling rates were increased by about 60% as the landfill was further away, and disposal fees per ton more than doubled. To address these concerns, the group developed a solution to transport the soiled bedding to a power plant, where the bedding would be used to produce electricity. To make the process more efficient, 30-yard dumpsters with augers were obtained to condense the bedding and reduce the number of trips to the collection site by more than 80% per year. Congratulations. Our next group is the NIH Sterile Processing Section Nursing Department, featuring Norman Hall, Dina Pokia, Tufik Remedo, Randy Cottle, Belinda Avila, Katina Ellie, Georgina Hunter, Christopher Dolman, Wandusin Gerberstosis, and Nisantanet Fita. In 2023, the NIH Sterile Processing Section significantly reduced the environmental impact of sterilization packaging for surgical devices in the operating room. This was accomplished by switching all containers that were encased in single-use blue wrap to metal containers. The department realized a tremendous reduction of waste and went from using 1 case of blue wrap per day to 1 case a month. Additionally, eliminating the wrapping prevented occasional delays in surgery that would happen when there was a hole in the blue wrap, resulting in the item having to be wrapped and sterilized again. Congratulations. Next up, we have the CDC prioritizes furniture reutilization during a decommissioning project. So the CDC's Office of Safety, Security, and Asset Management, or OSAM, Asset Management and Services Office, or AMSO, Design Support Services Office, or DSSO, decommissioned 7 leased buildings from FY 2022 through FY 2023 and repurposed the furniture to a new leased facility in Washington, D.C. As a part of vacating the 7 buildings and establishing the new leased facility, reuse of furniture, fixture, and equipment, or FF&E, was a priority. DSSO went above and beyond to find ways to reduce the furniture at other CDC campuses. The 9 leased properties where reuse of FF&E was prioritized resulted in just over $1.9 million in FFE cost savings to the CDC. In addition to cost avoidance, the reuse of furniture and office equipment had a significant positive impact. Congratulations. And finally, we have the FDA OLS Environmental Training Curriculum Team. In FY 2023, based on trend analysis from the FDA Environmental Compliance Audit Program, the FDA OLS Environmental Training Curriculum Team, using principles of economies of scale, introduced 2 new environmental training courses targeting key facilities and environmental health and safety program managers. The training courses were designed to enhance the use of risk assessment strategies and waste minimization and pollution prevention and improve environmental compliance, recycling, waste diversion, and reduction. This resulted in significant savings and improved environmental compliance and sustainable practices, as well as increasing climate literacy and awareness across FDA facilities nationwide. Congratulations. That concludes the environmental stewardship category. Thank you for your attention, and I'll pass it on to our next presenter here.
Thank you. I'm excited to present this next award category, which is Advancing Climate Adaptation and Resilience. This category encompasses those who promote agency planning and action to assess and reduce climate risk, build climate resilience, developing climate resilience tools, programs, and assist sustainable building business operations, funding activities that spur innovation and development of clean energy technologies and infrastructure. Our first HHS Green Champion Award winner in this category is Commander Matthew Hunt. This is for the NIH Climate Vulnerability Assessment. Lieutenant Commander Matthew Hunt, General Engineer with NIH Sustainability Branch, leads climate vulnerability assessments that are critical to identifying climate risks, which enables the NIH to prioritize investments. Commander Hunt worked with contracting staff to award climate vulnerability assessment contracts for each NIH campus. These assessments consist of 4 phases for each campus, including phase 1, aggregate, align climate data, and propose the top 3 risk categories. Phase 2, which is review water and energy use data, master plans, and campus-specific resources. Phase 3, which is to conduct on-site visits and assessments. And phase 4, develop and prioritize list of mitigation projects and actions. NIH has completed phases 1, 2, and phase 3 is underway. And by leading these assessments, Matthew is preparing the NIH to develop more climate resilient infrastructure and facilities. Congratulations, Matthew. The next winner in the Advancing Climate Adaptation and Resilience Award category is NIH Bike to Work Day. Winners include Joseph Cox, Anna Centeno, David Friedman, and Yaroslav Sebek. The 2023 NIH Bike to Work Day pit stop was hosted by NIH Bicycle Commuter Club and the Office of Research Services, Division of Amenities and Transportation Services, and featured refreshments, prize raffles, and additional biking-related activities. The National Bike to Work Day recognized NIH as the largest participant of the 100+ pit stops in the DC, Maryland, and Virginia region. 202 riders checked in at Building 1 pit stop and amassed 2,199 total round-trip commute miles, equaling 889 kilograms of emissions reduced. Many of these first-time participants of the event continued on to utilize biking as a method of transportation after Bike to Work Day. Congratulations again to those winners. Next up, we have the NIH NIEHS Refrigerant Management Plan. Winners in this project include Bill Steinmetz, Carrie Hartung, Paul Johnson, Julia Johnson, and Rachel Fison. In FY 2023, the NIH Institute of Environmental Health Sciences implemented Refrigerant Management Plan, which promotes alternatives to refrigerants with high global warming potential when purchasing new equipment such as chillers, air handlers, and air conditioners. Adherence to these procurement policies reduce the potential for Scope 1 greenhouse gas emissions during refrigerant equipment failure, repair, maintenance, and disposal, and it avoids Scope 3 greenhouse gas emissions associated with the manufacture and replacement of such equipment. The Refrigerant Management Plan also serves as a regulatory reference guide summarizing EPA requirements for refrigerant leak testing, record keeping and reporting, as well as equipment maintenance and disposal. Presentation was created and shared with facility engineers as part of the initial implementation process, and components of the plan are now being referenced during project reviews that involve installation and repair of refrigerant equipment. Congratulations again to those winners. And now moving on to our next award category. This category is electrifying and optimizing the federal fleet. And this category recognizes advancements in 100% zero emission vehicle fleets, including acquisition, deployment, management of vehicles and charging infrastructure, reducing petroleum and fleet use, increasing the use of alternative fuel, and optimizing and right-sizing fleets. The first winner in this category is Lieutenant Brian Sims from the NIH Division of Police Fleet and Sustainability. Lieutenant Brian Sims is the fleet manager for NIH Division of Police. Lieutenant Sims completed extensive research on the most cost-effective and beneficial way to replace NIH police gas vehicles with hybrid and plug-in electric vehicles prior to the issue of Executive Order 14057. He was there well prepared and began the process of transitioning to hybrid and plug-in vehicles. Lieutenant Sims' work will benefit the environment by reducing carbon emissions, fuel usage in the NIH police vehicle fleet. Additionally, operational costs will also be lower due to reduced maintenance and requirements. And congratulations again to Lieutenant Sims. Our next winner in the electrifying and optimizing federal fleet category is the FDA OFEMS Beam Solar Powered Electric Vehicle Charging Implementation Group. And these winners include David Manchus, Danielle Hoop, Andrew Dempster, Kelvin Lawson, and Alan Zawatsky. The Beam Solar Power Electric Vehicle Charging Implementation Group advanced electric vehicle program at FDA's White Oak campus through the implementation of modular solar powered EV charging stations. In January 2023, FDA initiated the acquisition of 4 freestanding modular solar power EV charging units powered by carbon-free electricity. And the 4 units are intended to be a pilot program to test the feasibility of deploying the modular solar power units at other FDA locations. Since implementation of the Beam pilot, 18 new members have registered to charge their EVs on the White Oak campus, increasing the total registered EV drivers to 297 for an overall increase of 92 in the year 2023. Congratulations to those winners. And our last winner in the electrifying and optimizing federal fleet category is CDC's Fleet Sustainability Program Strategic Advancements Project. Winners include Shirley Austin, Wyshell Boyd, Kenneth Tatum, Tyra Riley, and Kent Bowen. CDC's Fleet Sustainability Program implemented fleet and transportation management efforts to reduce petroleum and fleet use and increase the use of alternative fuel, hybrid vehicles, plug-in hybrid vehicles, and battery electric vehicles. Telematics were used to review vehicle usage and implement steady reduction in fleet vehicles each year. With the deployment of electric vehicles, this team collaborated with CDC's Facilities Office to plan for the installation of charging units, and CDC currently has 30 electric vehicles on hand with 9 more on order. And additionally, CDC has 25 charging ports at 5 different campus locations and expects to have more installed in the coming year. Congratulations again to these winners. And I will turn it over to the room. Lucy, I believe, will present our next award category. Congratulations again.
The decarbonizing federal buildings category recognizes efforts to reduce the climate impacts of federal buildings and facilities, including improving energy and water efficiency, eliminating or reducing fossil fuel use, advancing sustainable building practices and construction, optimizing utilization of facility space, using performance contracting, and advancing 100% carbon pollution-free electricity, and facilitating procuring and producing or deploying new CFE. Our first awardee is the FDA OFEMS Jefferson Laboratories Complex Transition to Carbon Pollution-Free Electricity team led by Gregory Tapp, Bruce Booth, Ann Wenzel, Prashant Gangal, Diana Hirschfield, and Reggie Taylor. Executive Order 14057 requires agencies to transition federal electricity consumption to 100% carbon pollution-free electricity, or CFE. The first federal government commitment to 100% CFE was in Arkansas, where the Energy Tech Arkansas LLC Go Zero program was launched to provide 100% CFE to government agencies. In FY23, the FDA Jefferson Laboratories Complex participated in the program and committed to transition to 100% CFE beginning in FY24. JLC's energy consumption equals 50% of FDA's total energy consumption for its owned sites. Transitioning to CFE at JLC will reduce the carbon emissions at FDA's own sites by half, resulting in an annual reduction of 22 million pounds of CO2. Our next group, the Developing the NHGRI 2023 Freezer Replacement Program to Decarbonize NHGRI Labs. Ellen Rolse, Emily Nouveau, John Garvey, Patricia Ann Messick, Brian James Wendell, Andrew Nicholas Hogan, Danielle Denise Boyce, Catherine L. Brooks, Brandy L. Robinson, and Amy Louise Mooney. This group identified ultra-low temperature freezers as a significant source of carbon emissions. The average ULT freezer on the NIH campus consumes 8,961 kilowatt hours per year, roughly the equivalent of the average home. To address these concerns, the NHGRI 2023 Freezer Replacement Program was created to procure and distribute 10 new Energy Star certified eco-friendly ULT freezers. The program will save approximately 42,000 kilowatt hours of energy, reduce carbon dioxide production by 31 metric tons of carbon dioxide equivalent, and reduce electricity utility fees by $4,710 annually. Our next awardee is the NIEHS RAL Building Roof Replacement and Refurbishments. Allison Carver, Cameron Thompson, and James Victor Stansel. The NIEHS ORF completed the replacement and refurbishment of the Building 101 Module D 16,000 square foot roof. The primary objective of this project was to enhance energy efficiency by replacing all wet insulation with dry, incorporating 39% recycled material, and coating the entire roof surface with a reflective membrane capable of deflecting up to 88% of ultraviolet rays, reducing solar heat gain. Substantially completed in September 2023, this innovative solution promises energy savings estimated at $8,000 per year and $100,000 of savings throughout the roof's 20-year lifespan. The project has already been replicated and 20,000 more square feet of roofing will be replaced in FY24 on the NIEHS campus. Congratulations. The NIH Optimizing Facility Efficiency, Achieving Cost Savings Through Improved Steam Condensate Return, Michael Shaw Jr., Vanessa Argote Macia, and John Luis Frantaginello. The NIH Central Utility Plant, or CUP, generates steam, chilled water and compressed air to meet the needs of the NIH Bethesda campus. The steam generated by the boiler and cogeneration plants is transferred to the building heating equipment and in the process generates condensate water. A higher condensate return from the buildings to the CUP is indicative of improved energy efficiency and reduces the need for makeup water, leading to savings in fuel, water, and chemicals. The target performance indicator for steam condensate return is 75%, but the CUP seldom achieved this target, and in 2022, the condensate return dropped below 36%. In FY23, a campus-wide project was launched to repair the steam condensate return systems and heat exchangers. This undertaking resulted in a significant increase in steam condensate return to an average of 65%, resulting in annual savings of $785,000. Congratulations. The next group in the category is the FDA OFEMS UESC Energy Conservation Project Phase 10. The FDA Mirror Creek Road Complex implemented Phase 10 of energy conservation measures in the Module 1 and Module 2 buildings. The ECMs implemented include lighting retrofits to upgrade existing lighting to light emitting diode, control upgrades to include occupancy sensors, building envelope improvements by sealing the structure with weather stripping, addressing air leakage and penetrations, and sealing vertical expansion joints. The estimated annual savings of the ECMs is 6,030 BTU with a cost savings of over 85,642. Excuse me. Congratulations to the group. We'll now hand it over to Gopi and Leo to close the ceremony.
Yeah, I can. Oh, thank you everyone for staying to attend our ceremony. We definitely did go beyond half an hour, so thank you for everyone. But what an impressive group of award and winners and projects. I want to thank Andrew Mayock, Secretary Cheryl R. Campbell, and Minu Shakuri Eliza for their remarks. Just one final reminder to check out our HHS Go Green Get Healthy website for the annual outreach events, contact information to get involved with HHS sustainability efforts within your division, and in the fall to nominate your projects, programs, and colleagues for the fiscal year 2024 Green Champion Awards. Another way you can access the HHS Go Green Get Healthy website is to type Go Green Get Healthy in the HHS Internet search bar. Thank you again to our speakers, award winners, and attendees and organizers. Have a great day, everyone.